Hi, I'm Rakia. This infection prevention and control education series is produced under the guidance of the Taiwan Medical Mission. Today's topic is CAUTI bundle care, simple, evidence-based steps to prevent catheter-associated urinary tract infections. These infections are common but preventable, especially when each step is followed carefully. Let's get started. CAUTI, catheter-associated urinary tract infection, is one of the most common healthcare-associated infections, caused by the use of urinary catheters. It can lead to longer hospital stays, higher medical costs, and even increased risk of death. The good news is, with proper catheter use and care, CAUTIs are largely preventable. Preventing infection cannot rely on a single infection control measure. It requires a set of evidence-based clinical practices that are applied together and consistently to achieve the best results. This is what we call bundle care. There are two main reasons why inserting a Foley catheter can easily cause a UTI. First, the muscles around the urethra normally stay tight to prevent urine from leaking. However, once a catheter is inserted, it creates a pathway for bacteria to travel up the tube and reach the bladder, which can lead to an infection. Second, the urethra has a lining and some normal bacterial flora that help protect it. But when we insert a catheter, it can damage the lining to some extent, making it easier for bacteria to enter and cause an infection. Since catheters can increase the risk of urinary tract infections, we only use them when absolutely needed. Here are the common situations where inserting a urinary catheter is appropriate. When someone can't pee on their own, for example, due to prostate problems or nerve issues, the bladder can't empty properly, so a catheter helps drain the urine. When the patient needs to be measured urine accurately in the ICU or with very sick patients, we need to check how much urine they make to monitor kidney function or treatment response. During or after certain surgeries, especially for long surgeries or operations around the bladder or pelvic area, a catheter is used to keep the bladder empty or help with recovery. If a patient has an open wound near the buttocks or private area and keeps leaking urine, a catheter can help keep the area dry so the wound can heal better. When a patient can't move or get out of bed, for example, after a spinal injury or major fracture, using a catheter helps with urination without needing to move. End-of-life or comfort care in hospice or palliative care, a urinary catheter may be used to reduce discomfort, minimize the need for frequent diaper changes, and avoid unnecessary turning or repositioning. When the bladder needs to be washed out, for example, if there is blood in the urine with clots, a catheter is used to flush out the bladder and prevent blockage. If assessment confirms that the patient truly requires a urinary catheter, the following practices must be strictly followed. Perform hand hygiene before and after catheter insertion. Aseptic technique must be used when inserting a urinary catheter to minimize the risk of infection. Maintaining a closed drainage system means not disconnecting the catheter unless absolutely necessary. Keeping the system closed helps prevent infection. Make sure the urine bag hangs below the level of the bladder and does not touch the floor. This helps urine flow downward and prevents it from flowing back into the bladder. Avoid kinks or twisting of the drainage tube. The catheter should be secured to the patient's thigh to avoid accidental pulling and reduce the risk of injury. Educate caregivers on proper urinary catheter care. This includes cleaning the perineal area daily, emptying the urine bag every 8 hours or when it is more than 2/3 full, and avoiding any contact with the drainage spout to prevent contamination. Most importantly, always remember to reassess the need for the catheter every day, and use a checklist to ensure all infection prevention steps are correctly carried out. As mentioned earlier, preventing infection cannot rely on a single control measure. Every infection prevention step listed above must be properly followed to effectively prevent catheter-associated urinary tract infections. If you liked our video, don't forget to give it a thumbs up and share it. We'll keep posting more helpful infection control tips.